Hi everyone, hope you are all safe. Though the topic of my today's campaign episode is little different, still I would like to state about willful negligence of the people. If we go to the public place, it seems that there is no disease like corona exists. Is it the right attitude to prevent coronavirus? No, don't take it too lightly because the disease is highly contagious, painful, and deadly sometimes. No, I am not trying to scare you, but want to highlight that the awareness and adherence will be able to save our society from the disease. Now I am going to share the views of Dr. Manushi Roy, professor of West Virginia State University, USA.
Although it caught us by surprise, but it was expected because there has been literature in the past and there has been extensive research writing that such a pandemic was inevitable. We were not prepared for it and we were not conscious about it. It was not even in my awareness, but the scientists had warned us that such a pandemic is in the making and it would happen sometime.
Yeah.
Um, could it be avoided? Yes, it could have been avoided. We could have dealt it a lot better, but that's a different area. Um, so my view is, yeah, it's a new reality. And although it caught me by surprise, uh, it is true that it was inevitable because there's a lot of literature stating that it was inevitable. I mean, Bill Gates had even in his on a TED show talk had told clearly that this is going to happen. But the whole world was not prepared for it. Even the richest nations like United States, which has dealt it very badly. Tapper, as COVID-19 may remain with us in future, what are the precautions need to follow to remain safe? Mask, right?
Yes.
I mean, um, the preventions are put into place, keeping in mind um, not to not to stop the spread of the pandemic, but but more so to not to overwhelm the health system. Because if so, therefore, the measures have to be seen in from the perspective that we do not overwhelm the health system, which it does not have the capacity to cater to so many COVID-19 positive cases. Yeah. For example, what is happening in Delhi right now, there is no bed available in any hospitals in metropolitan cities in India. So not so the so one has to see the preventive measures or the precautions that we have to take from the point of view from the point of view not to overwhelm the um, health system. So one is, above all, what I hear from in the US, particularly from Dr. Fauci, the leading expert, is the mask. I mean, mask is a part of our lives, and it will remain a part of our lives till we find a effective vaccine. And we are not wearing the mask for ourselves. We are wearing the mask for the other person, so that we can prevent the infection. It is for others that we are wearing the mask.
Yes.
Mask, hand washing, hand sanitizing, definitely not.
Social distancing.
Definitely not bleaching or drinking bleach.
Yeah. Okay.
And washing our and using gloves, rubber gloves, rubber gloves. Like I go for physiotherapy now, I have to wear a mask and I wear rubber gloves and disposable rubber gloves. So when I'm holding the equipments, so there is a rubber gloves, and then come and dispose the gloves off and then wash my hands. And in the physiotherapy uh, um, uh, premise, all the equipments are then wiped away by by antiseptic or antibacterial lotion. So the next person also, doesn't get the infection. When I went to the doctor's office, they are allowing only one patient at a time. So if I go and meet Dr. Thopse, I will go and park my car in the car park. I will call him from my car. A nurse will come out, take my temperature, and then if she thinks I'm okay, then she will allow me in, of course, wearing a mask and wearing gloves. I will go. I'm the only patient in that entire office space. He will see me, and then when I leave, they will disinfect the room before they bring in the next patient. It's and of course minimizing social distancing and minimizing. I'm minimizing my going out. So I am in this apartment for I don't know from how many months. From mid-March, April, June. March, April, June. I mean, I don't go, there's no entertaining. There is nothing. There is just, what are the essential services has to be done. Going to the grocery store to buy groceries, or going to the doctor. Then I go to the PT. That's about it. You can't do anything else. How can we create a necessary awareness at grassroots level for effective prevention of COVID-19 spread? This is with regard to India, because I hear a lot of Indian news. And particularly, I hear not the English news as I hear the Hindi news. That is, one particular channel that I hear a lot is Ravish Kumar's Desh Ki Baat, which gives you which gives you very good reporting what is happening at the grassroots level, at the ground level. So my answer is framed with the perspective of India only. In India, there is a lot of, as you know, there is a lot of illiteracy, and there is a lot of unawareness about this pandemic, the nature and the severity of this pandemic, beside the nature and the severity, how contagious it can be, and the cruel death that can follow. And now I don't have it on the top of my head, the total number of deaths in the world, but I know that in United States it had crossed 107,000 deaths due to COVID-19. The effective measure is one is that you have to have mass awareness. And going by, Kerala has been one of the most effective models of able to curtail COVID-19, and going by what the health minister of Kerala said is tracking. A volunteer should 1:1, that is, one person will track another person. I mean, Kerala model has been very highly successful. So one person has to track another person. So a volunteer, it could be a health worker, that where it is happening. So that and through Ravish Kumar thing, ওরা এখন না মানে করোনাকে দেবী মতন করে পুজো করছে। So obviously there is that like chickenpox, eradication of chickenpox, you have to have a very, very high level and very focused building of awareness about this disease. A very, universal, like a blanket spread awareness of this disease. And so one is that. Second is, of course, it's easy to say awareness of the disease where people like the migrant laborers of our country who had, who started walking back to their home states, is it does not make a difference if you are তোমার পেটে যদি খিদে থাকে. So it has to be a multi-pronged approach, and no particular government has been able to deal with it. Australia, of course, is a exemplar. More than Australia, it's New Zealand is an exemplar. In fact, they're held up as being, a success story. But as far as India is concerned, it's very concerning at this point. And I believe আজকে সকালেও আজকে এখানে NPR বলছিল কি it's going to peak in July. I think June or July, end of June and early July. তার মানে ভয়ঙ্কর. I mean, it will be ভয়ঙ্কর.
Thank you so much, Manushidi. Now I would like to come back on the main subject area of my today's episode. Mr. Manojit Sengupta, an IT professional from Kuala Lumpur, shares his views with us.
Hello everyone, my name is Manojit and I am working in the IT industry. Today I will like to talk about COVID-19 and its impact on global economy. As we speak, COVID-19 has impacted more than 10 million people across 215 countries. This is first and foremost a human tragedy having a crippling impact on the global economy. As per the latest reports, the effect on the global economy already could be 3 times worse than the 2008-2009 global crisis. Most of the countries over a period of time affected lockdown, fundamentally cutting off human-to-human contact, disrupting the demand side of the economy and also impacting the supply chain within the country and at an international level. To refer to some data points, all major market indices have lost between 25 to 50% since beginning of the year. We have seen significant erosion of global GDP, with most of the economies are predicted to be in the negative territory. As the COVID-19 started from China, the manufacturing hub of the world, the first industry segment to be impacted was automotive. This impacting the supply chain of global automotive players. Travel, tourism and hospitality became the hardest hit sectors as the countries triggered lockdown. Travel restrictions had a huge impact on the airlines industry, with airline stocks losing value in the markets, with some airlines even filing for bankruptcy. Another industry significantly impacted is construction. This is an unorganized sector in some economies like India. Lack of construction activities also impacted commodities market, players and economies such as Australia, which has high dependency on this segment. Unemployment has gone up significantly across economies. This has resulted in governments providing subsidies, which then has triggered an increase in fiscal deficit. Lack of spending has also triggered reduced collection of tax for government authorities, and as such, this has created massive challenge for governments to sustain the subsidy programs. On the positive side, significant adoption of digital channels for payments has been a silver lining for the banking industry. R&D sector in pharma has seen major investment, with all major players in the race for antiviral and vaccine production for COVID-19. The other industries that can benefit from the behavioral change in consumers are logistics and packaging industry, where consumers are spending more online than retail stores. So, what is the way forward? The situation is still evolving, and we need to keep a watchful eye to understand its continuing impact. But the immediate priority is to provide financial assistance to the economically challenged section of the society and then to ease liquidity in the market. Hopefully, these steps will trigger consumption and increase in demand will trigger an economic revival in the coming quarters. Thank you, everyone. Stay safe and stay at home.
Thank you, Mr. Sengupta. I am again returning to Dr. Manushi Roy. I placed a question to her that, as a sociologist, what are the views of her on socio-economical challenges that COVID is bringing to the society? And what are the possible solutions?
See, you can't have an answer to this question in a universally, okay? So it has to be contextual. So I'm talking in terms of India, and to some extent, universal in poorer countries. Say, for example, now that your child and many other children who have been pulled away from school, right, because of COVID-19, or there is a lockdown to prevent the cases, right? Now, in many homes, in many poor Indian homes where there is a preference for a male child or there is a male bias, many girls will not return to school. If there is a choice, they will send the son to the school, and the girl child may not go back to school to resume her education, right? Either she will be pulled in to do domestic work, or she will be asked to put into informal labor to jhigiri kore khao. So I mean, this COVID-19, I mean, you're asking the socio-economic, that means definitely they will have a huge gender differentials, right? There'll be it will have an impact on how people will emerge out of this based on your gender, particularly. And you don't look at gender in an isolation, but you look at gender as an intersection, that is intersection of class, intersection of gender, intersection of caste, right? So if you're of a poorer class, and if you're a woman, or if you are a girl child, you tend to face the consequences far more than if you are belonging to the upper caste or upper class. Rural urban differences are there. Again, if you are from the rural area, then you'll find the consequences far more limiting compared to the urban areas. One is that there are, just think, at least in context of India particularly, the labor migrants. That was a huge impact of COVID-19. The people, informal migrant laborers working in the informal sector. I mean, they've lost their livelihood for now. It is very doubtful if these laborers are going to return to Bombay or to Mumbai or to Maharashtra or to Surat or to Gujarat, where they had, or to Bangalore, where they had gone with jobs. There is such a psychological fear, এত একটা ভয়াবহ জিনিস, it will, ওদের, they may not find the courage to go back for that work. Now, these laborers largely used to work in the construction industry. So obviously, the country will have a very bad, a very severe impact because there is no more informal labor. In a way, it showed the underbelly of India, that we did not take care of, we took it for granted, the workforce that used to prop us all up. So there's going to be tremendous, and India is going through a very bad economic phase. It is going to have a lot of um, dishevelment. I mean, a lot of mm, something good can also come out of it. Who knows? Labor laws can change, as they have done it in Uttar Pradesh or Bihar, was it? I think it was Uttar Pradesh, which has changed the labor laws now. And it is COVID-19 that forced them to change the labor laws. So the small now, what is small manufacturing units can keep this, whatever. There are many laws, and you can look at them. But it was COVID-19 which made them. So labor and laborers, the informal laborers, আমরা ভাবি কি হ্যাঁ একটা বেটা ছেলে যাচ্ছে. It was not. The internal labor, internal migration in India has changed its demography. There are a lot of women who migrate now. There are a lot of women migrate, and they are not only migrating from rural to urban, it is from urban to urban. মানে কলকাতা থেকে যাচ্ছে বোম্বে, বা ভুবনেশ্বর থেকে আসছে কলকাতায়. So people generally think, oh, rural urban migration. No, it is urban urban migration. A lot of my urban, and women too, women with children. So it is a very severe thing, you know. I mean, the consequence of COVID-19 will be felt for another decade. Imagine the small restaurants, not the big restaurants, not the established restaurants. মানে যারা চলতে চলতে যেটা আমরা খেতাম রাস্তায়, all those have gone. তুমি তো বোম্বে গেছো, ভেলপুরি, all that is gone.
Street food.
Because these are not the locals who did it, but the migrants who came, and they used to prop up this economy. So how the informal sector will respond to this COVID is yet to be seen. It's a question mark, and it's definitely going to have consequences on the other sectors of the economy. The COVID-19, if you look at from the social point of it, these are socio-economic, of course. COVID-19 has also opened up a lot of atrocities towards minorities. যেহেতু ওই কি হইতো জামায়াত ইসলামিয়াতে, because there was a congregation of a lot of people. Now it was like whole Muslim, everybody who was Muslim were targeted, that they are the ones who are spreading the coronavirus. Now, coronavirus knows no religion. Coronavirus does not know man or woman. I mean, it is irrespective of that. So, but it raises the ugly face of divisiveness, which is very unfortunate. It has happened it's happened in United States too. It's happening in United States between political parties, Republican and conservatives and Democrats, or Republicans and Democrats. President Trump মুখে মাস্ক পরবে না, and ওর যার লোকেরা আছে যাকে ওকে সাপোর্ট করে তারা কেউ মাস্ক পরবে না. Now I feel unsafe to be in their in presence of such people, but they will not wear their mask. So in the US, what I know, it's become a political issue, that, oh, this is nothing. And the people who are weak, people who are Democrats, or people who are fearing so much, they're the ones who are wearing masks. Now, the health intellectuals and the scientists and the chief health professionals, whether in India or in the US, they're constantly saying that, you know, one has to be humble towards this virus. You can't show your he-manship towards it. And so therefore, if you notice, I don't know the figures in India, but I know the figures in United States. The people who are most or let me put it this way: African Americans, Hispanics, people of color, people who are poor have been disproportionately affected by COVID-19. মানে ওদের numbers কোনো অনেক বেশি এই রোগের। It could be because lack of health access. It could be they're already in poor health. So it always attacks the weakest in the community. It attacks the migrant laborers in India, but I don't know the figures of how much COVID-19 has affected. I don't know the statistics, but I know a lot of stories from Ravish Kumar of how people are going from one hospital to another hospital to another hospital in Delhi to find a bed for their father or for their father-in-law or for their uncle, and finally being turned away from all these hospitals and the person is dead. So the system is overwhelmed. We are not prepared for it. I hope COVID-19 will wake us all of us up, including our leaders, that preventive medicine or preventive and social medicine has to be given a very high priority besides heart patients and cancer patients, but this should be given a very, very high priority, and that health system on preventive care should be very seriously taken, because this pandemic is, even if we find a vaccine for it, there's definitely going to be another pandemic sometime. We will live with pandemics. It's not that এটা হয়ে গেল আর কোনোদিন হবে না. No, it will come again, because we are destroying our nature. I mean, if you look at how did it all start? It started, they say that it has definitely jumped from an animal to a human in the wet markets of China. So they say. There's always, it came from China, but whether it was produced in a laboratory or whether it came from the wet market in Wuhan, there's a controversy, or I have not followed up on that. But this is not the last pandemic. It is going to come back again in some other form or in some other way. And we have to be prepared for it.
Yeah,
The whole world has closed down now.
Thank you, Manushidi. We will meet again in my next episode on different topics and views on it. Thank you.